Hi, it's Adrian from Advanced Dental Artistry. I want to walk you through a case today of Shaun. He's a very determined 22-year-old who actually started his own company of coaching football players one-on-one. What he's actually come in to see us for is really a cosmetic concern because his upper teeth are actually crowded and are not aligned. But more important than this is his underbite. And an underbite is when the lower teeth are actually in front of the upper teeth. And in his case, it was a developmental problem. Basically, his jaws developed that way and his teeth fell into that position. But also he actually suffered trauma from playing football, and that also made the condition worse and also made his jaw joint worse. There's actually only two ways to actually fix an underbite. One is, of course, orthodontic treatment, and in a lot of these cases it would involve jaw surgery. And the other is to use porcelain to alter the bite and the height of the teeth, and therefore allow us to actually complete cosmetic treatment after. In this case, we use some very minor orthodontics just to realign the teeth to minimize the cosmetic treatment. And then we did cosmetic treatment on his front teeth to realign his smile, and of course build up his back teeth to get his bite better. There are three very important things when we did this case. One is a lot of team planning, and you will see the technicians come in halfway through treatment just to basically check things, and there was a lot of planning that was involved before we started. One of the main things about this planning was a very early on trial smile. So what we did is before we touched the teeth, we actually trialed a smile on Shaun just to make sure that the end result was going to be perfect. And the last thing was changes to the teeth and changes to the bite can also have a very positive impact on the jaw joint. And you'll hear this from Shaun about how his jaw used to click a lot, and then during the treatment when we built up his teeth to a new height, it actually eliminated all of his jaw joint problems. So let's have a look at this case from start to finish, and I'll talk you through the case. So this is Shaun on his very first visit back in July 2016. And you've seen this profile view already. This is the underbite from the side, and close up you can actually see how the front teeth come in front of the upper teeth. And what we're going to do is we're going to do a trial smile very early on. This is on top of his current teeth, so it will give us an idea of how everything's going to look. What it's going to feel like, but it will give us an idea of where they kind of sit. With the mouth, the rest he shows about 2 to 3 mils, which is about right.
Yeah.
Okay, big smile.
Yeah, see, it only comes up to the
top of the gum, right?
Yeah.
It doesn't go any further than that.
Yeah.
Nothing like having 5 people sit there.
Do you feel like
Circus.
it's just counted down a
Tiny
fraction?
bit, isn't it?
Yeah, and probably centerline needs to be tweaked.
Tiny bit. Yeah, I thought it was a bit taken.
Yeah.
So, okay, very good. And you can already see in this photo and this video how different things look. So this is day of treatment. He's in the dental chair. That's pretty good. This is the review visit just a few days after. You can already see the massive difference here with his trial smile in.
Apparently you can do that.
Jeez. We kind of did those today.
Sort of do the laterals, a 1.5 type thing. Yeah.
Yeah.
Just get look again. They look terrific.
Yeah.
And after the review's been done, we just finished the case with the porcelain made by the dental technicians and the review of the final smile. And the best comparison's always a before and after video of the case, so you can really see how the smile looks when Shaun's actually laughing and smiling. Here we go with a comparison of before and after portraits. Final video here, and of course the final portrait just to finish off. Well, thanks for watching Shaun's case, and it's always important to remember that there's always options available for treatment. You can visit our website and look at some of our cases, or you can just catch up with us on Facebook. If you have any questions, you can always give us a ring at 1-800-SMILING, or maybe just drop us an email. We offer complimentary discussion visits, and we look forward to seeing you in the practice one day.